start, sir. Yes, sir. Good afternoon, sir.
Good afternoon.
Yes,
How
sir.
are you?
I'm fine, sir. Sir, please start by introducing yourself, sir.
I'm Professor LLOYD MULENGA.
Okay.
I'm a Director of Infectious Diseases from the Ministry of Health, Zambia.
Wonderful. So today we are at Accra International Conference Center attending the ICASA 2025. What is the essence of this program, sir?
So the essence of this conference is to bring, first of all, people who are involved in the fight against HIV and also sexually transmitted infections together.
Okay.
Discuss the progress which we have made so far.
Wonderful.
But also look at the challenges which we have had in responding to HIV and the related diseases.
Okay.
And importantly, engaging the community, especially young people. You know, where I come from, in my country, Zambia, we have 30,000 new infections of HIV every year. And of those, nearly 50% of those are happening in the young people with the age less than 30 years, which is saddening. And again, when you look at those, the adolescent girls and young women, those between the age group of 15 to 24 years are heavily affected by HIV. Okay. So we bring all these together and see how can we move forward, prevent those infections. Okay. Those that are positive, how can we treat them? And even as we treat them as human beings without discrimination, and also give them the best medications that are available. But also importantly, we have looked at the new models which are available for prevention. We now have injectable ARVs. In my country on Monday, we started giving an injectable ARV for prevention every 6 months.
Wow.
We have a young man who can come in, receive a jab. They are protected against HIV for 6 months.
Wonderful.
After 6 months, they come back and receive another jab. Again, they are protected. So we have those modalities which are available, and we need to share those experiences among ourselves and among the people that we are serving.
Okay. Sir, without taking much of your time, I would like you to advise young people. First, advise those that are positive, that have the HIV virus. What is your advice to them? Then later, you advise those that are yet to get the virus, that are negative.
So for the people that are living with HIV, yes, living with HIV is not easy.
A death sentence.
It's not easy. It's not easy. A death sentence at all.
Okay.
Living with HIV.
Because that is the mentality people have, that once you have it, it has no cure, that people start to discriminate you, people start to dissociate with you.
They should not do that.
Okay.
We now have people who are living with HIV who are taking one tablet once a day and they can live normal lives. We have people now who are in the 80s. They have been taking ARVs for 30 years. So really we just need to accept one another and make sure that if you're living with HIV, take the medicines every day. And very shortly, even the injectables, they may be taking one injection a year or one injection every 6 months, and life will be easier. Okay. The same thing like people who have hypertension, or people who have diabetes, sugar disease. They can also live normal lives, and we don't discriminate against them. Similarly for HIV, we don't need to discriminate people living with HIV. A young person, an old person, anyone living with HIV, take the tablet once a day and you lead normal lives. Okay.
So for those that are yet to have the virus, what is your advice? What is your call on them?
First, we should not put them as yet to have the virus, because we don't want them to have the virus.
Exactly.
And because we don't want them to have the virus, we have these prevention measures. Okay. I know we've been preaching for a long time on abstinence. It's not easy that everyone is going to abstain. And we have other modalities. They can use condoms. Okay. Now we have even tablets. Someone can take the tablets
as a bulletproof.
Yes, they can take the tablet every day and they are protected.
Wonderful.
Now we even have injections which can be given either every 2 months or injections given every 6 months, also as protection.
Wonderful.
These are measures which are available to protect against HIV and encourage people that are at high risk to follow these procedures and take the medications.
Okay. So finally, your general message to the entire public, the whole world, with regards STI, with regards destigmatizing it, which is key.
The message out there is that we need to treat each other with dignity. Anyone can get any of these infections.
Every human being is a candidate.
If everyone can do so. Okay. And let's just access those available tools for prevention. And for those that are positive, let's access the available tools for treatment.
Thank you so much, sir. God bless you, sir.
Thank you.